Nursing care plan on Pancytopenia. First of all, identification data, then chief complaint of the patient, then medical and surgical history, then birth history because it's a pediatric NCP, and immunization schedule history, and dietary habits and growth and development chart. We will include it because it's a child patient, and then personal history, and then social history and family history, the family composition, and after that we will do physical examination and head to examination. So overall we will do that all examination on the child patient. After that we will write conclusion, medication and lab investigation, and then nursing assessment, then nursing diagnose. After that we will explain all three diagnose one by one, then progress notes. After that, health education and conclusion. Also add bibliography. Thanks for watching.